Hey guys, welcome and welcome back to this YouTube channel. So if you have not subscribed, kindly consider clicking the subscription button so that you get more content related to nursing, related to medical topic. So today we have these things here. If you're a nurse, if you're a doctor, if you're a medical officer, if you're anyone who has been in any compound of the hospital, I hope and I believe you have come across this thing. These things are called cannula or cannula. Some people prefer calling them cannula, some prefer calling them cannula. All means the same things. So they're usually in different colors. So the different colors represent different gauges, and you have to know the higher the gauge, the smaller the needle. The higher the gauge, the smaller the needle. So I'm going to show you some of these colors and what they represent. We have color orange represent gauge 14, hash color represent gauge 16, white color represent gauge 17, green color represent gauge 18, pink color represent gauge 20, blue in color represent gauge 22, yellow in color represent gauge 24. Spinal needle, that needle that the anesthetists used to inject spinal drugs, represent gauge 25. And we have a purple which is gauge 26. Yes, I have a purple here and it is written gauge 26. Yes, if you can see, I don't know if you can see. Yes, it is written gauge 26. Green color represent gauge 18. Yes, I'm just confirming so that you be sure that I'm gauge 18, gauge 18. I don't know if you can see, but that is what is there. So you can't get a needle or this cannula needle which is green in color and it is written gauge 28. That is wrong and it should not happen at any cost. So you have to confirm before you use this. So let us look at their uses. Yeah, we said we are going to look at their uses. Let us look at their uses. So you see this, it has different parts. Yeah, and if you're a medical student, if you are a nurse, you have to know these parts. We have the needle here, we have the needle, we have the catheter, we have the brushing, we have the valve, we have the catheter wing, we have the injection port. In this thing, I'm only speaking about this thing. I will put it on the video so that you are able to see. We have the needle grip, also we have the flashback chamber. Yeah, those are different parts of these cannulas and you have to know. Yeah, we have the injectable injection cap. This is called injection cap. This thing that is with the is colored, is ejectable cap. And then we have lunar lock. Lunar lock is this one, where after you have injected lunar lock, after you have injected the patient, you can use this one so that you don't get the flashback, or you can use it to, yeah, you can use it to control the flow of blood before you remove the needle. So another thing that we are going to, so we have different gauges with different uses, where we have gauge 16. Gauge 16, we said it is harsh in colors. Gauge 16, we said it is harsh in colors, in color, and it is used with to transfuse large fluid volume. Remember we said the smaller the gauge, the higher the needle. The smaller the needle, the higher the gauge. Yeah, the smaller the needle, the higher the gauge. So gauge 16 is I think it is smaller compared, because we have up to gauge 26. So this gauge 16 is used to transfuse large volume, fluid volume. Also, if you need rapid infusion, if you also have a trauma, you have a patient with a trauma who is going for a surgery, and also if you require large vein, you will use gauge 16, which is orange, which is harsh in color. Also we have gauge 18, which is green in color, and this one you use a trauma, uses a trauma surgery. If you want to viscous solution, to transfuse viscous solution, blood transfusion, nurses and doctors, you kindly use the right gauge to transfuse blood. Blood transfusion is used with you have to use green needle or green granula to transfuse blood. And also if you want a large vein, you can use this gauge 20, which is what in color? Pink in color. This one is a routine transfusion of IV fluid, and it is mostly common use in the hospital for NS and ringus lactate. That's routine transfusion of IV fluid. Gauge 22, smaller fragile veins for kids, older adults, yes, older adults, and also slower infusion. So gauge 24 is used when you need slower flow rate, and also it is used in pediatrics and elderly. Which gauge have I not talked about? It's gauge 14. Gauge 14 is the largest gauge, and which is orange in color. Gauge 14, it's orange in color. Also it is used in large fluid volume. It is used when someone is going for a surgery. It is used when you require a large vein, and also it is used when you need a rapid transfusion. Yeah. So guys, we have talked about everything concerning this, the uses, the parts, and the colors of the gauges, and representation of the color or colors and what they represent. So if you have any question, you can leave it in the comments. You can leave it in the comment section so that we look on it. I think I've finished. Let's meet in the next video. Bye.